cellular rejuvenation program, what we do is we take out blood, and we've done this from a 76-year-old person. We've done it from multiple people. We take out adult blood, and from that blood, we generate an immortal cell, a cell that never dies. That cell is similar to an iPSC cell. We call them personalized regenerative cells. So what this is we take from the blood what we call a mutable stem cell. We have a special population that we have IPR. We expand that cell, and from that we take it and we make it into like an iPSC cell, a very early pluripotent cell. From that very early pluripotent cell, then we bank it, and we can make an unlimited supply. The beautiful thing, so people have published this, but the biotech field more or less hasn't even caught on to this. A pluripotent cell can be multiplied forever and does not develop mutations. So with that, we're making several things. Our lead program is liver failure. We're making hepatocytes. Liver is a multi-billion-dollar disease, liver failure. Right now, the only two options are liver transplant or hepatocyte transplantation. Hepatocyte transplantation is basically the single hepatocytic cells. This has been demonstrated to cure liver failure. It's just we don't have enough hepatocytes. We've already manufactured scalable number of hepatocytes, show that they work in 2 models of liver failure, carbon tetrachloride and acetaminophen-induced liver failure, and now we're pushing this towards the clinic. The other thing that's even more exciting is mesenchymal cells. Mesenchymal cells are autologous repair cells. They're repair cells. They can repair a variety of tissues. Right now, the big problem is, so mesenchymal stem cells got approved by the FDA in January of this year for treatment of graft versus host from the company Mesoblast. Mesenchymal stem cells, you've heard, they're used outside of the U.S. with some pretty spectacular results. Here's the problem. If you use autologous, if you use your own, you don't have enough of them. There's only so much bone marrow you can suck out of a bone. If you use adipose, again, you don't have enough. There's only so much fat tissue. If you use allogeneic, you can use younger ones, but the problem is they end up getting rejected. So sure, the allogeneic one is immature, and because it's immature, it's not seen by the immune system. But when you differentiate it to cardiomyocyte, that's going to be a mature cell. If it's going to be beating fast, that's going to be rejected by the immune system. So what we do is we take the blood, generate this pluripotent young stem cell. From that one, we can make young mesenchymal stem cells. With these young and they're autologous. So with these young mesenchymal stem cells, we are doing we're using them in liver failure as well. So we have 2 liver failure programs, but these young mesenchymal stem cells can be used for a variety of things, including for complete anti-aging. You may have seen the publications with a heterochromatic transfer where you take the plasma you take the circulation of a young mouse and you surgically tie a young mouse to an old mouse. And then you can see a rejuvenation of the old mouse. And as you've seen, there's different people that are collecting young blood and using young blood. Well, basically, you can have your own source of young blood, your own source of the young growth factors such as Klotho, GDF11, FGF, and so on. You can have your own eternal supply of this through these. So right now, the main focus of our company is 2 things. Kill out the old cells and then replace them with new cells. And we're taking a very cautious approach, diving into an indication that has no current treatment available for it. We're looking at stage 4 lung cancer patients that have not responded or failed to respond to immunotherapy or standard therapies. So we're diving into that to obtain proof of concept that we can kill old cells. At the same time, we're diving into liver failure where they're going to die without a transplant in weeks. We're going to have 2 therapeutic signals very quickly, and that will guide us. Now, if this doesn't work, obviously it's better to know it doesn't work a lot quicker than if do like a 5-year clinical trial like some of our colleagues have done in other types of senolytic drugs.